menopause is 45 to 51 years. Now gradually the age of menopause is increasing. That another term is climacteric. That is a period of time when the cessation of the function of the ovarian failure going to be occurred during the period of climacteric. At the end of climacteric, there is menopause. So inversely, that is the term menopause is at least 1 year of amenorrhea. At least in the backwards, if we go backwards, at least 1 year of amenorrhea. At the end, that is menopause. And the time needed to be menopause, there is the phase of climacteric. And there is another term is perimenopause, menopause and climacteric. Okay? And actually there is ovarian failure, cessation of function of the ovary. So all body are affected by the menopause. All body, our skeleton, our cardiovascular system, our female reproductive organs, all are affected by the period of the menopause. That is why it is there is change, there is lack of estrogen mainly. Okay, now we are going to, you see the perimenopause. Peri, what is peri? Surrounding, around, right. 3 years before menopause, followed by 1 year of amenorrhea. You see in the, there is a deficiency of the ovarian hormone leads to anovulation, and sometimes there is abnormal uterine bleeding also due to different causes. So for confirmation, at least 12 months of amenorrhea. So you see some demographic picture, and usually here, nowadays it is 51 years. Delayed menopause. Sometimes, you know, some patient come to us, there is no cessation of menstruation at the age of 55 years, 56 years, 57 years. So there may be some pathology. Uterine fibroid, endometrial hyperplasia, endometrial cancer also associated with the delayed menopause. There is delayed menopause also. So pathophysiology is ovarian activity declines, no estrogen, no formation. Ovarian, at first there is estrogen activity, but it is unopposed by the progesterone. As no ovulation, so no formation of the progesterone. Ultimately, what happened? If there is no estrogen, no progesterone, then what happened? Then the controlling of hormone, that is FSH and LH, will be increased. FSH, so when we suspect menopause, then we do the hormone test FSH and LH. It will be increased or decreased? Increased. Why increased? As no hormone, estrogen and progesterone. Okay, this is the some graph relation with the hormone relation with the according to age. And if FSH 50 times increase, LH 3 to 4 times increase. Okay, now hormone levels. Here there is, for you it is not so important, but FSH appears in large concentration, low estrogen below 20 picogram per ml. And so now that it is important. Risk factors for menopausal related problems are exposed. What high risk? If there is early menopause, you know the surgical menopause, nowadays it is so common. Why surgical menopause? When ovary along with the uterus is removed, total abdominal hysterectomy with salpingo-oophorectomy, then it is surgical menopause. Sometimes following chemotherapy or radiation, there is also cessation of the ovarian function. Okay, so family history of early menopause also, and some drugs, like sometimes we use Gynae, heparin, corticosteroids, clomifene. These are also related with the relatively estrogen deficiency. So these are also important. Atrophy of all the structure, and then that is size, all the structure are atrophy, smaller. Menopausal symptoms, What are the symptoms of the menopause? All of us we know that is, symptoms are the neurological related to the libido, urinary tract and genital tract disorder. Menstrual symptoms sometimes at first started with some irregular bleeding and then stoppage of the menstruation. And there is sudden, maybe sudden cessation hota pare, sudden cessation of the menstruation or gradually decreasing, gradual diminution in the amount of blood loss with each regular period until menstruation stops, or gradual increase in spacing of the periods until they cease for at least period of 1 year. So other symptoms, what are the other symptoms that needs patient guidance and treatment? What are the hot flushes? Very common. Mood swings and irritability, low energy, weight gain, loss of libido, night sweating. রাত্রিবেলা অনেক sweating হয়ে যেতে থাকে, difficult in concentration, ঘুম হয় না, and bone loss. Hot flushes. Why it is happen? Hot flushes. This is due to estrogen deficiency also. Waves of vasodilatation affecting the face and neck and last for 2 to 5 minutes. Okay, then following that severe sweating, night disturbance, palpitation, angular pain, sometimes there is chest pain, depression. With the passage of time, severity of the hot flushes, আস্তে আস্তে এটা বডিতে অ্যাডজাস্ট হয়ে যায়. হট ফ্লাশেস ইট বিকাম অ্যাডজাস্টেড. কেন ফ্লাশিং হয়? হট ফ্লাশিং কেন হয়? That is more secretion of the FSH and noradrenaline which disturb the thermoregulatory system. And that is so, total thermoregulatory system is hampered. And vasomotor symptoms neurological. Paresthesia take the form of sensation of pain and needles in the extremities. That is the feelings. This is also due to the urogenital atrophy. And others, urinary problem due to why urinary problem? Class follow করতে পারতেছো? কেন problem হয় urinary? There is atrophy of all the epithelium. So there is burning sensation, dysuria, stress incontinence. The support become less. There is no estrogen, so supporting structure will be loose. So there is stress incontinence and urge. And there is no secretion. There is no other glandular secretion, so dry vagina, dyspnea and fecal incontinence also. Estrogen deficiency causes, like sometimes the all hormone control the our reproductive organs. Estrogen causes some changes, progesterone causes some changes. So there is some urethral carbuncle, dysuria with or without infection. Carbuncle is the that is granulation tissue formation, like healthy granulation tissue, and it is due to estrogen deficiency and chronic irritation, stress incontinence. So genital vagina, atrophic vagina reduces the vaginal secretion, and dry vagina causes dyspnea. Okay, and complication and late sequelae. You see the bones, what is the bones? Osteoporotic change, broken, fracture. And vasomotor symptoms, hypertension, sometimes associated with the menopause, arthritis, vertebral bone osteoporosis, so kyphosis, sometimes kyphosis, pain in the back, and cardiovascular system. শুনতেছো? cardiovascular system, এই জন্য আমি পাওয়ার পয়েন্ট দেখাই না. পাওয়ার পয়েন্ট দেখালে তোমাদের অ্যাটেনশন অন্যদিকে থাকে, কথা বললে বেটার. আচ্ছা, কার্ডিওভাস্কুলার ডিজিজ কি হয় বলো, দেখে দেখে বলো. তোমরা বলবো, আমি দেখাবো শুধু. আর ইউরোজেনিটাল অ্যাট্রোফি বলো. দেখো এখানে কম্পেয়ার করছে, তাই না? একটা ইয়ং বাচ্চা আর বয়স্কদের বাচ্চার হাত. অস্টিওপোরোসিস হলে এই অবস্থা হবে. সো বোন মাস ডেন্সিটি, যদি কমে যায় সেটাকে বলা হয় অস্টিওপেনিয়া, কমে যায়. আর হোয়াট ইজ অস্টিওপোরোসিস? অস্টিওপোরোসিস মানে তোমার অস্টিওক্লাস্টিক সেলের অ্যাক্টিভিটি বেশি, আর বোন মাস হলে অ্যাজ এ হোল বোন মাসটা কমে যায়, রাইট? Pathophysiology, these are the pathophysiological change in osteoporosis. Here like the other risk factors ki family history, low calcium, then bolo smoking, bolo early menopause. Okay, cardiovascular disease ki hoy? Estrogen is always cardioprotective. Estrogen bhalo মানুষের শরীরের জন্য। So if less after menopause কি হয়? SDL শরীরের জন্য ভালো না LDL ভালো? SDL ভালো। দেখো ভালোটা কমে যায়, SDL কমে যায়, LDL বাড়ে। So there is a possibility of the atherosclerosis, and there is formation of the emboli, but that is cardiovascular changes. And then formation every possibility of the thromboembolism, atherosclerotic change, ischemic heart disease, MI, possibility of MI, and then ultimately stroke. You see the stroke? What is stroke and what is heart attack? MI, stroke in the brain, cerebral circulation কমে যায়, infarction হয় ব্রেনে, আর MI heart rate. So what are the skin changes? If there is no collagen, collagen is our supporting of the connective tissue, তাই না? collagen কোত্থেকে তৈরি হয়? From where it is secreted? Collagen, fibroblast, so function is less, so no formation of the collagen. Central nervous system, দেখো কি অবস্থা, সব কিছু কমে যায়, cerebral blood flow, so সময় থাকতে সব কিছু করতে হবে, তাই না? তোমার আর কিন্তু তোমাকে বডিকে অ্যাডজাস্ট করতে হবে, মানিয়ে নিতে হবে। অনেক কিছু সবাই মেনোপজটাকে মানিয়ে নিতে পারে না, যার জন্য ডিপ্রেশনে ভুগে। কিন্তু লাইফস্টাইল চেঞ্জ করতে হবে, লাইফস্টাইল তোমাকে চেঞ্জ করতে হবে।